I am beyond thrilled to announce that doors will soon be opening to the Wholesome Fertility Method online program. If you've been listening to this podcast, you know that I love to infuse meaning and spirituality into my practice, and I'm so excited to be sharing this program that I have put my heart and soul into. I have left no stone unturned with the creation of this program. This course includes everything that I provide for my patients, including how to understand your charts from a Chinese medicine perspective, detox recipes and protocols, simple and easy ways to go clean on products and cosmetics, research-backed nutrition that has been shown to improve fertility health, fertility-boosting supplements and herbs, breathing exercises, bonus fertility yoga videos, techniques to awaken your innate power to heal yourself, and what answering your sacred call really means. My deepest intention with this program is to empower and inspire you to align with your highest self. I will be offering both independent study as well as added coaching, which has limited spots available. If you're interested in getting on the waitlist, then don't wait. Visit www.thewholesomefertilitymethod.com now, as doors will only be open for a limited time. You will not want to miss it. Episode number 58 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist, here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Denise Wiesner. Denise is the founder of the Natural Healing and Acupuncture Clinic in West Los Angeles and is an internationally recognized traditional Chinese medicine practitioner, specializing in the whole systems Chinese medicine approach to women's health, sexuality, and fertility. Since 1994, Denise has treated and helped women manage challenges from menstrual disorders through menopause and from infertility to pregnancy. Using a combination of acupuncture, diet and lifestyle counseling, nutritional supplements, and Chinese herbs, Denise has helped thousands of couples navigate the tricky and often stressful journey toward fertility without losing their loving connection. She has a Bachelor's of Science in Kinesiology, a Master's of Arts in Traditional Chinese Medicine, and is a certified sex coach. She is board certified by the State of California and American Board of Oriental Reproductive Medicine, and a charter member of the Fertile Soul, Clinical Excellence in Fertility Program. Denise teaches professional seminars to medical doctors, OBGYNs, and nurse midwives on the application of Chinese medicine in obstetrics and gynecology, and has published articles on acupuncture and infertility. In addition to a thriving private practice, Denise lectures at conferences, works closely with the reproductive endocrinologists, and is a professor in the doctoral program in Chinese medicine, fertility, and women's health at Yosan University. Denise enjoys leading groups for individuals and couples to help their fertility journey, incorporating breath, meditation, and education. So welcome to the podcast, Denise.
Hi, I'm so happy to be here.
Me too. So we were just talking in the pre-talk about your book, Conceiving with Love, and we're going to go backwards. And also I want to introduce you and find out your story about how you got to specializing in fertility. But we were just talking about this whole topic of conceiving with love because I had seen this book 2 days before I got in touch with Denise. So it was kind of a funny coincidence. And it's just a very interesting thing because we both feel very passionate about adding that love aspect to fertility. And so I think it's really cool just how I found you in the book. And let's start with you sharing your journey and how you got to specializing in fertility.
Okay. Well, it began. No, I had a child, and I was really I was really lucky to conceive my first child naturally, and then when I conceived my first child, I found out I was a carrier of a genetic disorder called Tay-Sachs, which is my husband at the time was a carrier as well, and so we found out that our pregnancy would have a 25% chance of being not okay. And it turned out our first child was fine, and we had him, and that was, okay, great. It's going to be easy to have the second. But the second one, I had a miscarriage. And then I had 3 months later, I got pregnant again, and then had a Tay-Sachs baby I had to terminate. And then I thought, oh, well, it's so easy for me to get pregnant. I'll just get pregnant. And then it wasn't
Mm-hmm.
easy for me to get pregnant.
Oh, wow.
And I went to, a lot of different healers. Like I went to fertility
This is
acupuncture.
before you did acupuncture.
No, this is during I did acupuncture. I was like,
Okay.
acupuncture works, and I had treated a lot of women's health, but I was like, oh, acupuncture is good for fertility, and I went to lots of like naturopaths and acupuncturists, and there was a really disconnect between the Western and the Eastern. They weren't
Mm-hmm.
marrying the two. It was like sort of like this woman gave me herbs and said, I'm working on your lungs, and I thought,
Mm-hmm.
I don't want to work on my lungs. I want a baby.
Right.
So, and from that journey, I found out that I had a low thyroid, which, is not really good for getting pregnant. And
Mm-hmm.
I decided that, I wanted to help women, and I wanted to bridge the gap between the West and the East and really talk about both because they're so very important.
Yeah.
Right. Yeah.
So that's so then you ended up specializing and of course teaching as well.
Right. Yeah. I teach about it in women's health. Yep.
So let's start with pelvic floor health in both men and women, because a lot of times I think a lot of women, it seems to be more of a woman thing or thought of as a woman thing.
Yeah.
But you mentioned in your book, both men and women, it's important for.
Yeah, I treat a lot of men in my practice, and they start confiding in me a lot about what's going on, and they don't know a lot, really.
Mm-hmm.
There's not been a lot of education for them about sexuality or fertility, and so the pelvic floor for men has to do a little bit with controlling. You can use it for controlling ejaculation, and sort of having an idea of like what's going on down there. And
Right.
a pelvic floor, a man can utilize his pelvic floor, figure out where it is if he can move his penis. Like if
Right.
some men can do that. It's the idea of just having, that the pelvic floor is like a hammock that holds everything up. And we want that hammock to not be too weak, and we don't want it to be too strong. Sometimes it can be too strong, and that can lead to pain for men.
Mm-hmm.
I had a man that I referred to a physical pelvic floor therapist, and she was like, "You're going to the bathroom number 2 wrong." Because
Oh, wow.
he was having all this pain. He was like pushing, and something was wrong. So she was re-educating him how to correctly use his pelvic floor. So it's a valuable tool to be able for men to understand their pelvic floor, for even in terms of sexual dysfunction. And for
Mm-hmm.
women, it's important because we want to have a strong pelvic floor, but not too strong and not too weak. So this idea
Right.
of like people, do jade egg practice where they put a jade egg in them, and then they do yoga with their jade egg, and they have
Mm-hmm.
really strong vaginal muscles. It's like we want our muscles to be strong. We also want them to relax, right? We don't
Right.
want them to
Right.
be
Right.
too tight. Yeah. So
It's a
it's
good balance.
right. It's a good balance.
Right. And you talk about I thought this was kind of a cool term. You talk about arousal, as you refer in your book, as brain crotch connection. I love that. That's great.
Yeah. Yeah. I spent a lot of time talking about low libido in my low
Hmm.
sex drive, because it seems to me that a lot of my female patients come in and they check that box like low sex drive. And I was always very
Hmm.
curious about what that is. Like, why do so
Right.
many women have low sex drive? And there's a whole thing with arousal versus desire, and this
Hmm.
idea that for women, we're not it takes a while for us to be aroused, and like even 20 to 45 minutes for our tissues, our erectile tissues that we have to engorge with blood, much like a penis engorges with blood.
Hmm.
And so, brain crotch connection is so important because part of the arousal process for women is, like, I mean, I don't know, when someone takes out my garbage, it makes me
Right.
aroused.
It's
It's
very
like,
hot.
wow. Yeah, it's very hot. It really is.
Yeah.
It's like any help for me is like, really, like, you fix that? Fabulous.
Yeah.
Right.
Right.
But it's so much more than just below the waist
It's
arousal.
true.
Right.
Yeah.
Yeah.
Absolutely. For
Yeah.
women,
For women.
especially.
Yeah.
Yeah.
Men are very visual. So
Yeah.
men are fast to boil. Right. And part of men's journey is learning that to slow down to allow the woman enough time to be aroused. And it could be like arousal by, starting in the morning of just like, sending a love note or helping a woman. I mean, sometimes it's very arousing just to have other things, the intimacy piece, right? The connection piece,
Yeah.
not just that sort of arouses us and helps us get in the mood. So for women, we are, I think part of sexuality is really between our ears. Yeah.
Absolutely. And so what's interesting about this is kind of how I found your book. We were talking about oxytocin in the pre-talk
Mm-hmm.
and how in Chinese medicine, there's that heart uterus connection. And of course, the heart houses the mind. So, it's between our ears. It's the same kind of thing. It's that connection. It's that bonding, which oxytocin does. And it's an interesting thing because I feel like, and we've talked about that. I think you agree because I saw it in your book. You were talking about oxytocin as being something that basically helps contraction and helps the orgasm and helps the uterus suck up the sperm.
Mm-hmm. Yeah, there's a theory called the upsuck theory that says that if you have an orgasm, it's sort of, and there's sperm and semen right near your cervix, that those contractions will help pull up the semen with the sperm in it, or actually pull up the sperm into the
Hmm.
uterus by upsucking. And it's the oxytocin, it's sexuality, it's blood flow, it's all those things. But we can have that without an orgasm too, right? I mean, we don't always
Hmm.
need an orgasm to get pregnant, but that idea of
Right.
pleasure and arousal and like, love and the heart, it's so very, very important, I think, for connection, for bonding, for intimacy, for making a baby. And it gets lost.
Absolutely. Oh, completely. And it's a big thing. I think that people focus so much on they just focus so much on everything, the timing, and it seems because of all of that information, that like brain stuff,
Hmm.
of being focused on numbers and levels and dates and times, that's more important. We get so focused on it, we lose like the major foundation, which is what happens during that desire and arousal, like the both
Hmm.
combined, and what happens to our bodies in response to it. And so I could see that being very easy to miss because of the rigidity of trying to make babies. And I'm
Right.
sure that that's probably one of the reasons you got so interested in also being a sex coach.
Yeah. Yeah, I mean, I love that I get to talk with people and they tell me their personal details of things that they've never told anyone. This sort of, and a lot of them, believe it or not, have really difficulty in the sex department where, they used to not have difficulty, but since making a baby, it's like nobody wants to have sex anymore. It's really hard to get their husbands like on a time schedule. There's problems with, men getting erections and having to perform on demand, and men sort
Hmm.
of like, if I get a couple and I mention baby making sex, like they both look at each other and then they look at me. It's like I know a big secret that's going on in their lives.
Hmm. Yeah.
Yeah, because it's, some people opt to do inseminations and IVF just so they don't have to have sex. I've
Yeah,
seen it in
because
my
it's a
practice.
lot of pressure.
So much pressure.
Yeah.
Yeah.
And so so what do you talk to your patients about, or how do you get them to maybe kind of dial back and just spend a little more time, preparing?
We talk a little bit about just intimacy and connection and trying to establish that without just having this like once, 2 times a month or whatever, how many times a month having sex to make a baby. It's like, really getting back that pleasure and intimacy that they once had. And so I talk about, just getting back to really it's getting back to the basics. Uh,
Mhm.
with things that we all know, but we just don't do.
Right, right. Isn't that the story of everybody's life?
Yeah, it's true, right? Because of lack of time, right? We're all very, very busy, it seems.
It
So
is,
people
yeah,
don't put time
absolutely.
into that. Yeah.
And, can you talk about factors that can inhibit libido?
I mean, there's so many. And in fact, I was just asked to do a podcast, and the guy didn't want it about fertility, but he really wanted about women's body image. And I thought, wow, that's such a
Mm-hmm.
big one. And it's not just for women, it's for
Right.
men
Oh,
too.
yeah.
But this idea of not feeling good in who you are.
Mm.
And this is our culture, right? It's like, you're supposed to be perfect, and we're supposed to look like a porn star, and or
Mhm.
perfect
Right.
shape down there, and you
Right.
know
After working 12 hours.
yeah, and just all those things. And people, and especially women who are doing, injections or doing IVF or insemination, they're usually bloated and hormonal, and probably the last thing they don't feel good,
Mhm.
and that's sometimes that's a huge thing, how you feel, if you don't feel your sexy self. And I was just talking to a patient earlier today about this very thing. And I was like, go get some lingerie and wear it for
Yeah.
you. Forget your partner.
Right.
Like,
Right.
wear it because it makes you feel good. Right. And the idea of
Absolutely.
being our sexy self is really like feeling into how beautiful and perfect we are, exactly how we are right now. Yeah. Which
Yes.
I lose sometimes. I lose that
We all
moment.
do. I think we all do.
Yeah, I'm like, oh,
But it's a good reminder really to just take that time and just feel good and even like dance at home. Honestly, like it was funny because I was having this conversation the other day and with somebody who's like, you don't see a lot of adults just dancing. When you're a kid, you dance all the time. I mean, yeah, some adults do,
mhm,
which is great, but not a lot of people we lose that. It's just
yeah.
nice to kind of get back into that moving and
Oh,
that
yeah.
sensuality and
I,
yeah,
I go to a dance class. I'm actually going tonight. It's like a free form dance class, and it's
that's great.
amazing. The intimacy between people. People dance together. I mean, people you don't even know. It's like we're actually very starved to be touched. Everybody.
Mhm.
This idea of like it's just like penis and vagina together.
Right.
It's really missing the point of our
Yeah.
sensuality, right? Of,
Mhm.
like you said, dancing and eating together, and touching each other, massaging each other, bathing each other. It's like all that you might have done in the beginning of your relationship, kind of like baby making. All of that goes out the
Yeah.
window, and it's this very clinical, like, we need to get sperm up there as soon as
Right.
possible.
Yeah, that's right. Get it in. Come on.
Yeah,
Yeah.
yeah. I have 5 minutes. Um,
Yeah, exactly.
yeah, right. It's making time and slowing things down, and doing things. So body image is one thing that gets in the way, but there are also others. Fatigue is another one. People
Mhm.
are tired. I don't think anybody gets any enough sleep these days. I look at people's
Yeah.
numbers. It's like 6 hours of sleep. And,
Right.
if you're tired, and we say in Chinese medicine, right, you don't have enough qi, enough vital energy. We need
Mhm.
vital energy, and we especially need our vital energies to be strong. We say in the kidney department, and the energy of our sexuality, which is our fertility. So if you're
Mhm.
feeling exhausted and you're drinking way too much caffeine and you're whatever, your energy is going towards something else. It's not going to baby making and sensual sexuality. So dealing with fatigue and getting enough sleep is really, really important.
Yeah, absolutely.
Yeah.
Without a doubt.
Yeah, and then there's like medications. So many medications get in the way of like orgasm, right? I mean, SSRIs, some people that are taking SSRIs have a difficult time orgasming, or women and men ejaculating. And that
Mhm.
can be like I've had patients think like, God, it just takes so long. And it's like, that's a problem to have. But I mean, it's this idea that sometimes we have so many SSRIs in our, and I'm not saying to suggesting that everyone go off them, but to like assess like what's necessary, what can we do naturally, just to maybe sometimes it's just it was put there for at one point, and a person keeps taking it and doesn't really need it
Right.
anymore. So to really assess
Mhm.
and all sorts of medications can have problems in that department. It gets in the
Yeah,
way.
absolutely. Interesting SSRIs, I mean, that affects the heart shen,
Yeah. Interesting,
which
right?
that goes back to the heart uterus connection and the oxytocin orgasm, you know?
Right. It's all very connected, and we have that in Chinese medicine, and also like health problems. If there's any type of underlying health problems, that's why right as we as acupuncturists look at the whole body. We look at like what a person's eating and how they're digesting the food that they're eating, and what's going on with their breathing, because we really want them to be as healthy as possible for good sexuality and good fertility, right? And that
Absolutely.
gets in the way if you're like, you're coughing all night, or you have really bad allergies, or you're bloated and gassy, and it's like, ooh, who wants to be touched with with all that? So
With all that mucus.
yeah, exactly. So it's and in the wrong place, right? You
Yes.
put the mucus in the
That's
right
right.
place.
We do.
And also like people taking it, allergies and antihistamines, and those dry up cervical mucus. So all these things, being healthy is so very, very important to like get we feel when we're feeling, that's why people get pregnant on vacation. They feel like they're resting. They don't have as much stress. They are eating,
Right.
they're like, it's just a much better time. It's really cliche, but it's
There's more
true.
flow, you know.
There's more flow. Yeah. Uh,
Yeah.
yeah. So that, and then there's like, sort of something that, that mismatched lovers, where people like one person has a really high sex drive, one person has a low sex drive. I see this a lot in my clinic too, where, and nobody talks about anything. Like, no,
Well, because they don't wanna say the wrong thing.
it's such a shameful topic to talk about that
It is.
people put up with, never say what they need or want or desire to anybody. They don't talk about it. And so it just goes
Right. And
unanswered.
they both know it.
Yeah. 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 So like stress and trauma also get in the way, right? Trauma and stress can really lead
So,
to,
like, deep, beliefs, something that has happened when you're younger, maybe holding on.
yeah, I mean, that can be, we're talking about the heart uterus connection, but, and for men as well, but like deep held beliefs or sexual abuse or any type of abuse can really cut that energy and leads to all sorts of problems later on.
I was gonna say, and I repeat this all the time on my podcast, is that, reproductive health for the body is not forefront. So, really what it comes down to is just balancing your body in general. Like, if you can balance your body in general, everything falls into place. But the body's not concerned so much about reproductive health when it's concerned about trying to get everything else in balance. That's something that I repeat over and
Mm.
over and over again, but it's the truth, you know?
Yes, that's so true. Yeah, it's like it really actually when we're stressed, the energy goes away from reproductive health and goes into our adrenal glands to deal with the stressors that we have. It's like the
Absolutely.
blood flow is connected. So like if you want your blood flow, you want to feel like juicy and right there. And
Exactly.
yeah,
That's right.
exactly. Not like, oh no, I have this like assignment due, or I've got to finish this thing, and work occupies your brain. You're not dropped into your energy of your fertility.
Right. And then, it was interesting because I remember seeing on Dr. Oz, he was talking about like traveler's constipation, for example.
Mhm.
Somebody's holding it in for so long, and then as soon as they go home, they go. And it happens because the body, if it knows that it's going and it's on adrenaline, then it knows that it can't just relax and let go. Well, the same thing happens, I would imagine, with the body knowing that it can start a family. It's like you're on the go and you're so stressed out and it doesn't feel safe, then the body's not going to be like, okay, let me just relax here and start a family.
Yeah, the body's pretty wise.
Yeah, it is. It's incredible.
Absolutely.
So, what are some of the causes that you've observed in people who have aversions to sexual pleasure?
I think you touched on it earlier when you talked about beliefs, this idea that we're not, and especially this is really women. I think maybe men too, but I think more women, that we're not allowed to feel pleasure. We're not
Hmm.
allowed to experience really deep pleasure. It's like you can even find this out when you talk to women about their masturbation history. There's such
Hmm.
deep held beliefs that masturbation isn't okay. And still,
Right.
and there's been studies that show that women who masturbate when they're younger have an easier time at orgasm,
Right.
because it's the idea of letting go and that we deserve pleasure, that pleasure it's okay to feel pleasure, right? In many cultures,
Yeah.
that's not the case. That's not
Right.
what we're taught. Yeah.
Yeah. It's taboo in a lot of cultures. Not all, but yeah. I mean, it's definitely, there's a lot of shame involved in it.
There's so much shame in just discussing sexuality. Even just talking to your partner about like maybe a fantasy you have, or even though I think for a lot of the pregnant women, the biggest fantasy is just getting pregnant. I mean,
Right.
the fertile patients, right?
Yeah.
But just like like how you want to be touched, or just like, oh, I noticed that I like it like this. Like asking for what would give you pleasure, or
Right.
experimenting, like, oh, I like that way you touched me there. Oh, that's a little too hard, or that's too soft, or try. It's so hard for us to ask for what we want in that realm as women, I think. you
It's
know
true. Oh, absolutely.
yeah.
Because I think initially a lot of women, I know I did earlier, is just that you want to please. You
Hmm.
have the disease to please, and you want to just make sure that everybody else is comfortable. And
Right.
I've yeah, it's crazy, but I've seen a lot of people do that until they get a little older. But sometimes you need to kind of be convinced to start thinking about that earlier on.
Yeah, I mean, it's this idea that we deserve it and we can ask for it and we can have conversations, hopefully, about this topic. However, I've seen in my practice that some, couples, it's hard for them to converse, and it's hard to ask for what they want. Even men don't want to talk about it. And if we don't start talking
Yeah.
about it, and it doesn't have to be like at the moment, but if we, even just talk about how we want to make a baby, like how do we want to proceed? Do you want to know when I'm ovulating, or do you want to not know? Because like not every man wants to know when their partner's ovulating, right? So
Right.
this idea of what do you call it, of knowing and talking, I think is a really important thing. Conversing, having communication.
Yeah, definitely. And I think sometimes people think that when you have conversations about it, it kind of ruins the mood. But I think it's actually, it creates much more intimacy and much more comfort when you actually discuss it and have the conversation and don't make it awkward.
Yeah, or you don't have it like when you're in your bedroom. Like maybe you have it over dinner. Like, hey, I just want to like, or you just say, or even just asking like, hey, are you game to like exploring this together? Or we could, I have so many practices in conceiving with love that our partner exercises to do. So that actually could be like, are you game for trying an exercise? Like here it
Right.
is. We can just follow
Yeah.
along, and and then we don't have to have so much conversation, but it's sort of implicit in the exercise that we'll be trying something different to increase our intimacy. Just so couples have, it's right there for them.
Right. Definitely. And you do retreats?
Yeah, I would love to. I haven't yet done retreats, but I definitely want to do retreats with couples. I think
I think you should totally do retreats.
yeah,
I
yeah.
thought, well, you do workshops, right?
I do
With
workshops.
couples?
Yes, I do workshops, but
But you haven't done
I
actual
haven't
like
done a retreat.
couple of
But
day
yes, if
retreats.
you're interested, email me and I will set one up.
I think that would be amazing. I feel like it's calling for one.
Yeah, exactly. I mean, just really to spend the time being together, as a couple, when there's like not an agenda of like how we have to do this, we have to work. I think it's so significant for couples to be able to spend quality time together. Where they're exploring each
Definitely.
other and exploring things they haven't done. It's very useful, and having fun. Having
Exactly.
fun,
Yeah.
laughing. Some of this is just fun, right?
Absolutely. I mean, it's meant to be.
Right. Definitely fun. I had so much fun. I just lent clothing for one of my friends to go to a workshop that I had attended on sexuality. Yeah. And they have
Mhm.
all these like, dress up days where you're wearing all these things. And I was like, yeah, come to my closet. And it was, it just should never put anything on that like hinted sexuality at all, or
Mhm.
sensuality. And she just had a field day and then she went shopping and she got lingerie and she got a garter belt, and she was telling me all the stuff that she got, and it was just like exploring the unknown for her. And
Yeah.
how fun was it for her? She was like giddy.
And I think that people are going through this fertility journey, they need that little break. I mean, they need a little time to just be like, "Okay, whatever. Like, let's just like have fun for this weekend, whatever it is." Just give them that like time, that break.
Yeah, where everything's not focused on conceiving. It's
Yeah.
focused on connecting. And it's hard.
Yeah.
It's hard to switch gears. It's hard to get that because it's always in the back of your mind, right? So it's like hard to get that out and just be in the moment and trying to really enjoy each other and have fun and laugh and do goofy things, and and things you've never done, and explore and really connect.
Yeah, without a doubt. I completely agree. And I love the fact that, like I said, I was always drawn to this book, and then you and your teaching, because I think that it just touches upon something so important. We could eat all the great foods that increase fertility. We can take all the supplements. We could do all the herbs, all the acupuncture. But really, at the core, if we don't have that connection, that's at the base of everything. And also, it's something that we're starting a family. It's meant to. It really starts at the husband and wife, or the wife and a husband
Right.
and
The
it really
partners.
starts. Yeah, the partners. I mean, that's the base. It's the foundation of the family.
Yeah, and I do work with a lot of couples that have to do like IVF for many reasons. I have a couple right now that's
Mm-hmm.
doing it. They're adorable, and they're doing it because she's a carrier of a genetic, and they don't want to pass it on to their kids. So they're doing so
Mm-hmm.
much IVF, and IVF is super hard. It's like
It
you're
is.
really like you're going to the doctor's office all the time. There's like times you can have sex, time you can't have sex, and the partner has
Yeah.
to ejaculate in a cup, or even if you're a woman and you're going through it, partners for I have those couples too. It's just an added thing where people are stressed out just doing it. So more important, to really connect in those times, and have more intimacy and be a team. And even in my book, I have a whole thing because nobody was talking about like the timing of sexuality and fertility treatments. And I really felt like, God, they just give you a little, a sheet at the doctor's office and said like, yeah, like pelvic rest or don't have intercourse. Well, sexuality is so broad. It's not just about, again, penis and vagina. So,
Right.
especially in same sex couples, it's like, what can you have and what can't you have? I feel like that's
Right.
really important to address as well.
Yeah, definitely. And then I was going to say, there's this debate on after IVF, after a transfer, to have sex or not have sex. And some people say not to. A lot of reproductive endocrinologists say not to. And then some people say actually that I think there was a study that if you do, it actually increases blood flow.
Yeah, I don't know if it was from an IVF though, or maybe it was from an IVF, that study, but
Hmm.
yeah, I think that it's this idea, and there's no research saying that you can or cannot. By the way, I think that
Right.
reproductive endocrinologists and the ones that I've spoken to say that they really just they sort of strip everything away so that you don't go, oh,
Hmm.
I had sex, it didn't work, I shouldn't have had sex, that's
Right.
the reason, or I
Uh-huh.
exercised and oh no, it didn't work, that's because I lifted some weights, right? So if you take everything off the table and just be like, lay low, do nothing, then
Hmm.
nothing's blamed if it doesn't work. Yeah. I think that
Right.
that seems to be more of the consensus than actual research on having an orgasm and like dislodging an embryo. Because one of my doctors pointed out that if this really were the case, that probably none of us would be here because
Right.
because
That's such a good point.
because when
Right.
an embryo, many of us who got, our parents got pregnant with us, they had sex and they got pregnant and they had, they didn't know it and they had sex again, right? I
Right.
mean, people
Right.
had sex all the time, and if it was
Right.
right in natural conception, in
Yeah.
IVF, it's a little different, but if an embryo is really embedded and it's healthy, orgasm, sexuality, it shouldn't dislodge an embryo.
Right.
But
Right. Yeah. Good
yeah,
point.
I always defer to whatever the clinic says. And some people don't want to have that you to have intercourse till you get the first ultrasound with the heartbeat. I've even noticed. So it's yeah,
Really? Oh wow.
it's
No, I haven't heard that.
yeah, it's different for many clinics, but I mean, I get it. And there's, it depends also if it's a frozen embryo transfer versus, if it's a fresh transfer, which not a lot of people do anymore. But because, obviously women's
Hmm.
ovaries can be very huge, and there's a risk of having intercourse and having them twist. If you're
Right.
putting, an embryo, if you're,
That's a whole
yeah,
other
that's a
thing.
whole
Yeah.
other thing. Yeah.
Interesting. And so, yeah, it's definitely, there's so many different topics like that that we don't really know. There's not as many studies, but things are assumed, and it's definitely interesting to talk about. Are there any tips that you can share with the listeners on helping them connect with their partners if they're like stressed and going through all these challenges? I mean, you did mention a couple, but if there is there like one takeaway, some just like one thing that they could do?
I think. I told you, it's like, keep it simple. So if like I had to do one
Yeah.
thing, I really think that eye gazing, and I talk about this in so many podcasts, but eye
Mm.
gazing is so very, very important. The eyes are like the window to the soul, right? The eyes are our liver energy in Chinese medicine, which also connects to our genitals. And this idea of actually
Mhm.
really seeing your partner and being seen is like
Yeah, I
really
like that.
intimacy. And I know that people even bring it further into like eye gazing while making love, like actually taking in your partner. It doesn't have to be the whole time, but seeing this beautiful, magnificent soul that you've chosen to make a baby with, that you've chosen to partner with, and like kind of
Right.
drinking them in. This idea of drinking each other in by through our eyes, and then through our senses. So not only through eye gazing, but like deep hugging, where we just sort of push our bodies together and we breathe together. Simple things that we, again, it's sort of like, okay, got to do the foreplay, a little bit on the breast, a little bit over here. It's like, it's somehow, if we just slow that down into like just breathing together and slowing time down for a moment and looking at each other, I feel like it's so simple. It sounds so simple. Lighting a
Yeah.
candle, playing some music. I mean, these things are simple, but they set the stage for something to be different, right? Just putting candlelight in your room kind of changes the whole energy, you know?
Right.
And putting on some nice music. You mentioned dancing. I mean, I think sometimes if we just make it simple, it's very
Yeah.
effective.
I agree. Sometimes the simple things are the most powerful.
Definitely.
I'm reading a book called Atomic Habits,
Wow.
and he talks about that. It's Atomic Habits because if you change really, really small things, you can make huge changes. Whereas if you do something too big, it's like you're trying to create a new habit and you're going too big too fast, you're more likely to not continue.
God, I love that. That is so true. Sometimes it's just trying something different. If we just pick one thing, one little thing to do different, it could be simple. Like, what's really sexy and wonderful is whispering in your partner's ear. Sometimes just
And
whispering,
it feels good
it
too.
feels so good too. Like whispering some love thing in your partner's ear. I
Yeah.
mean, that's really simple, but like I forget to do that. you know,
Yeah.
Oops.
Do it
Yeah,
tonight.
exactly, but sometimes we just do something we've never done before. We just take a little risk.
Yeah.
Little, it doesn't have to be a big thing. It
Right.
really is profound. I love that idea. Yeah, that's true.
Yeah, it is pretty cool. But yeah, I think so. I mean, it's just one small thing, like you said, it's a very simple thing, but yet it's so powerful. I mean, really the eyes are you immediately get that connection even with anybody. I mean, it's just that's with a baby. That's how people bond.
Mm.
The babies bond to their mothers by eye gazing.
Right, right. And it's really like picking a sense, like, because it's right, our touch sense. So like, using touch, like sometimes people forget like to touch people. Like it's love. It's like using your fingers and putting love into them and touching your partner's face, stroking their
Yeah.
arm, right? Sometimes again, it's just putting love, looking in their eyes and stroking, putting a hand on over their heart. These aren't big things, but we
Right.
forget to do them.
Yeah, it's true. Absolutely.
Yeah.
People get busy,
We get busy.
but really making the time.
Yes. Absolutely.
So, do you want to share about Conceiving with Love, this amazing book that you wrote?
What would you like me to share?
I guess I had mentioned a little bit about it, but if you want to mention anything about what it
Oh,
is, where you can find it.
this book you can get from Amazon.com and the publisher Shambhala, so it's also on their site and some other bookstores. This book gives so many exercises for couples. I talk about anatomy and sacred anatomy. It's got Eastern traditions of tantra and Taoist practices, and they're simple. They're not really complex. It's got self-pleasuring and stress and trauma and orgasm and all sorts of things to help increase intimacy for couples going through fertility. Except for I've heard that people that aren't going through fertility also like the book. So in fact, men have like taken the book from their wives because it's really about connecting and how to increase intimacy. So you can also on my website, there's a link to a free chapter. if you want to explore chapter 1, it's denisewiesner.com. And there's also a link to where you can get there's audio versions of the book as well.
Awesome. Well, thank you so much. And also, where can people find you?
They can find me at my name, Denise Wiesner, Wiesner, Denise, Denise, denisewiesner.com. And there's all the information on how to work with me. I do fertility and sexual coaching and intimacy building with singles and couples.
And you also have a practice in Southern California.
I do. I have a natural healing and acupuncture as my practice. I'm sitting here right now. I have a clinic here.
Awesome.
Yeah.
Well, thank you so much for coming on. This is great.
Oh, thank you so much for having me. I'm really honored to be here.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I thank you so much for listening in and hope you have a beautiful day.